This presentation will discuss osteoarthritis in the geriatric population. On the agenda of osteoarthritis, or OA, we'll be discussing the overview, pathophysiology, causes and risk factors, exacerbations, signs and symptoms, labs and diagnostics, treatment and management, as well as resources available to the public. Hi, I'm Tiana, and I'll be providing an overview of osteoarthritis. OA is the most common type of arthritis. In fact, it's the leading cause of disability and pain in the elderly, and by age 40, 90% of the population has it. It is non-inflammatory, meaning it won't swell up or cause redness at the joints, like other types of arthritis. Also, OA is not systemic, which means it doesn't have any effect anywhere else in the body and is solely limited to the joints it affects. OA is described as a degenerative joint disease because the joint continues to break down over a period of time. Here in the center of the slide, we can see the tissues that make up a joint. This is the knee, including cartilage, tendons which connect bone to muscle, ligaments which connect bone to bone, synovium which lines and lubricates the inside of the joint, and two bones that meet at the joint. Now that we know what makes up a joint, we can gain an understanding of how OA affects our joints. With OA, the cartilage begins to break down, causing osteophytes, otherwise known as bone spurs. The breakdown or thinning of cartilage causes the joint space to narrow until eventually the joint space becomes bone on bone. The degenerative process that OA has on our joints was thought of as a normal process of aging and termed as wear and tear. But that's not true, and my colleague will tell you why.
Hi, my name is Yuin. Let's talk about what causes osteoarthritis. Changes in the tissue can trigger joint breakdown. For most people, the cause of OA is unknown, but metabolic, genetic, chemical, and mechanical factor plays a role in its development. And here is a picture showing a normal joint on the left and OA on the right. As you can see, the cartilage loss would cause bone-on-bone contact, would eventually causing pain and discomfort for the individual. Let's explore the factors that increase the risk to OA. There are various factors that contribute to this condition, and I am going to focus on the most prevalent one. Age plays a significant role, particularly over 40. The older you get, the higher the risk, especially for post-menopause women. Secondly, lifestyle choices such as smoking, occupation that involve physical labor, or engaging in certain sport or activity can elevate the risk because of the frequently repeated stress or possible injury. Additionally, obesity is another major concern because it adds extra weight on weight-bearing joints such as the knee and hip, which ultimately result in OA or worsening the symptom of the condition if the individual already diagnosed with OA, and as many other risk factors as you can see here. For many individuals with OA, some days are better, some days are difficult. Exacerbation refers to a sudden worsening of symptoms. Several factors contribute to that, including weight gain, overdoing activity, joint injury, infection, stress, and cold weather.
Hi, my name is Rose. I'm going to go ahead and discuss the signs and symptoms of osteoarthritis. Symptoms tend to build over time rather than show up suddenly. They include pain and stiffness in the morning, limited range of motion that may go away after movement, clicking or popping sound when a joint bends, especially when you're walking, running, or going up and down the stairs, fatigue and weakness, joint instability or buckling as when a knee gives out. Nodes in the finger may become enlarged as you can see in this picture. Now let's move on how can we diagnose osteoarthritis. During the physical exam, the doctor will examine the affected joint for tenderness, swelling, redness, and flexibility. X-ray, MRI. MRI shows detailed images of bone and soft tissues, including cartilage. CT scan, joint fluid analysis. The doctor might use a needle to draw fluid from the affected joint and send it to the lab for analysis, whether the pain is caused by infection rather than osteoarthritis. The next slide will discuss treatment and management of osteoarthritis.
Hello, my name is Julian. Let's go ahead and talk about treatments for OA. The goals of treatment are to relieve pain and joint stiffness. Improving mobility helps maintain your quality of life. Low impact physical activities helps you stay active, relieve pain, lose weight, and lubricates your joints for mobility. If pain or stiffness is an issue, consult your physical therapist for exercise plans that works for you. Losing weight helps relieve pressure from your joints and improves your quality of life. There are no medications that can cure OA, but Tylenol Motrin can relieve pain and help you be more comfortable and active. Topical pain relief, like capsaicin, blocks the transmission of pain, while the burning and cooling sensations of menthol and camphor distracts your mind from the pain. Other pain-relieving methods are heat, which can improve blood flow and ease joint stiffness, while the cold reduces pain and swelling. Braces and splints shift your weight away from the joint, relieving pressure and alleviating the pain. A healthy lifestyle helps you manage your weight and prevents the development of other health problems associated with it. Communicate. Ask for help when you need it, and let the people in your life as well as your work know when you aren't able to do activities like you used to. Glucosamine and chondroitin help grow new cartilage, which could relieve pain in your joints. If mobility is still an issue after the physical therapist, then the next step is an appointment with your doctor for joint injections or surgery. In arthroscopy, the doctor uses a small tube to look inside your joint. By making a few small cuts, the doctor smooths out rough spots. They can also remove damaged cartilage or bone fragments. This is a quick surgery and has less recovery time than the others. The Arthritis Foundation offers awareness, education, and referrals. They also help you connect to similar groups near your area. Creaky Joints provides education and finding support groups near you. They also help you deal with insurance issues concerning treatment payments. That concludes our presentation for OA. Thank you for your time.